Today's lecture is going to cover oral diagnosis and treatment planning. This is chapter 28 in your 9th edition Modern Dental Assisting textbook. You have your chapter learning objectives. Those include pronouncing, defining, and spelling the key terms found in chapter 28, listing and describing examination and diagnostic techniques used for patient assessment, discussing the role the dental assistant plays in the clinical exam, listing the 6 categories of Black's classification of cavities, differentiating between anatomic and geometric diagrams for charting, charting the correct restorative material for either existing or required treatments, charting the correct symbol for either existing restorations or required treatment, and also explaining the color coding of a chart diagram. In addition, you'll be able to describe the need for soft tissue examinations. You'll be able to describe pocket depth and bleeding index of gingival tissues, and you will learn how to record them. You'll also be able to discuss the importance of a treatment plan and be able to chart the findings of the periodontal examination correctly. Let's first talk about the dental assistant's role in exams. Your first role as a dental assistant is to assist the patient with forms. These forms can include a patient registration form or medical and dental health histories. Second, it's your responsibility to assist with taking and recording vital signs. Last week we discussed how important it is to record vital signs regularly on patients. Your third role is charting and recording the dentist's findings. Fourth, as a dental assistant, you'll be exposing and processing radiographs. In addition, you'll be taking impressions on patients and pouring up diagnostic models using dental stone. Another role would be taking photographs on your patient, organizing the patient record, and preparing for case presentations. So those are the 8 typical roles that a dental assistant has during examinations. The basic introduction to this chapter is that sound dental care begins with a thorough examination of the head, neck, and oral cavity. There are 4 typical reasons why a patient seeks dental care. The first example is a new patient. A new patient, think of someone who might have recently moved to your area and they're looking for a new dentist. Or it could be a patient that their dentist retired and now they need to find a new doctor. Or it could be that their insurance changed. Oftentimes, patients will go to a dentist based on who is a provider for their dental insurance plan. Second, a patient might seek dental care if they're having a specific problem. Consultations are another reason why a patient might seek dental care. Consultation is similar to a second opinion. And fourth, the reason for a patient to seek dental care could be that it's a returning patient. Returning patients come back for preventive appointments such as a prophylaxis, which is typically called a cleaning. Next, we're going to talk about techniques that are used for assessment. We have visual evaluations. This is when the dentist assesses existing conditions in the patient's mouth. The dentist will look at the following structures: soft tissues, tooth structures, existing restorations, and missing teeth. The next technique includes palpation. Palpation is when the operator uses fingers and their hands to evaluate tissues. What the dentist will do is they will use gentle but firm pressure on the patient's tissues to detect any possible swelling. The third technique is instrumentation. This is when the operator would use instruments such as an explorer or a probe to examine both teeth and surrounding tissues. In this photograph, you see the operator holding both a dental mirror and an explorer, and they are exploring the teeth. This picture shows a periodontal probe. The periodontal probe is used to measure the pocket depth of the sulcus that surrounds the tooth. Another technique used for assessment is radiography. Radiography could be either intraoral or extraoral. Radiography is useful to visualize certain conditions. The dentist could determine if there's any defective restorations. They'll be able to diagnose advanced periodontal conditions or any other pathologies. Also, developmental conditions can be visible on radiographs as well. Here's an example of an intraoral x-ray. This is commonly called a bite wing, and bite wings are typically taken during a patient's recall appointment. So their typical 6-month cleaning, patients get x-rays. And from intraoral x-rays, you can see that there is a lot of work on these teeth. Just by looking at the x-ray here, we notice a tooth is broken. We're missing the crown of a tooth. These bright white areas indicate restorations. So we see amalgam fillings on multiple teeth. We see crowns on the mandibular first molar and the mandibular second premolar, and in addition to those crowns we see root canal treatment, which is the bright white line traveling down the canal of the tooth. So x-rays are very helpful to diagnose certain conditions or existing restorations. And here is just another example of a bite wing x-ray. Again, we can gather a lot of information from here. We can see crowns on 3 teeth. We can also see a large amalgam restoration on the maxillary second molar. And we can see items that are not visible if we were to just look in the patient's mouth. Here, we can see the impacted third molar. Now this third molar is actually hidden below the gum tissue. The gum tissue is indicated here by this very faint gray line. So without this x-ray, we would not know that this impacted third molar existed. Other conditions that we can only see using x-rays would be advanced periodontal conditions, shown here by this loss of bone structure surrounding this maxillary second premolar. Now this x-ray is an example of an extraoral x-ray. Extraoral means that the film is outside of the patient's mouth while it is being exposed. The other films that we had just seen are intraoral, meaning the film is placed inside the mouth while it is being exposed. So extraoral x-rays, because they are much larger, we can see a larger amount of tooth structure, yet we can still gather a large amount of information. For example, in this x-ray we can see there are multiple restorations as well as multiple missing teeth. Additional techniques used during patient assessment include intraoral imaging. Typically, a video system is used, and there are some specific advantages to a video system. One of those advantages is being able to magnify an image. That way, both the operator and the patient can see for a better evaluation. Also, these video cameras that we use inside the mouth are easier to access difficult areas. And they provide a way to photocopy images to send in for insurance claims. It's also a great way to present your case to patients. If a patient can see what the doctor can, they often agree to have treatment. It's very hard for a patient to agree to have extensive work done if they can't physically see what's wrong with their tooth. And again, we've got medical and legal documentation can be provided as long as we save the images that are captured on a video system. In this photograph, you're seeing the dentist with an intraoral camera, and on the video screen, you can see what looks like a molar tooth with an amalgam restoration on it. So again, a great advantage is the tooth is blown up multiple times its original size, and both the dentist and the patient can see the same thing. Intraoral and extraoral photographs are another means of assessment. Here is an example of an intraoral photograph. This patient has cheek retractors in place, which allows a larger area of oral tissues to be photographed. Typically, you see pictures like this taken in orthodontics. In this slide, you're seeing a combination of intraoral images and an X-ray. And whenever a doctor is using these assessment methods, they like to use as many methods as possible to come to a thorough diagnosis. And this is a good example of that. The doctor used an X-ray. They saw this dark gray area, and that indicated that there is a cavity on this tooth. They could also see that cavity with their eyes simply by looking at the tooth. The doctor sees this dark brown spot indicating a possible cavity. Then they would use instrumentation. They would use an explorer to explore that brown spot to see if it was soft. If it's soft, it indicates that it is a cavity. Once the doctor opens up the tooth, they can see how extensive the decay is. And once they know how extensive it is, they can complete the preparation. So here's a great example of using different assessment methods to make a thorough diagnostic conclusion. Now, when it comes to recording the dental examination, there are some specific criteria that dental assistants need to know before you jump into charting. The first one is Black's classification of cavities. You also need to be familiar with tooth diagrams. Tooth numbering systems are a review for you. You've already covered these in your oral anatomy class. Color coding, charting symbols, all of those need to be understood before you can chart accurately. So the first one we're covering is Black's classification of cavities. There are 6 classifications. Class 1 refers to pits and fissures found on posterior teeth and pits on maxillary incisors. This illustration here, the red dots indicate where a Class 1 cavity would occur. The image on the left shows Class 1 caries on this buccal groove. The image on the right shows the red dots indicating a cavity on the occlusal groove of the tooth. Class 2 refers to the proximal surface of posterior teeth. And remember, when we're talking about proximal surfaces, we are referring to either mesial or distal surfaces of the teeth. And again, we have an illustration. The red areas indicate where the cavity would be for a class 2. So here we see both the mesial and distal side having red dots. Those red dots indicate a cavity. So again, class 2 is for proximal surface caries only on posterior teeth. Class 3 includes proximal surfaces on incisors. So again, we're talking about mesial and distal surfaces, but this time with class 3, those are only on incisors. So here's an example of that. The red area indicates the mesial and distal sides that have caries. Class 4 involves proximal surfaces and the incisal edges or angles of anterior teeth. So just like class 3, class 4 is only found on anterior teeth. It involves the proximal surfaces, but with class 4 we also include the incisal edges or angles of the teeth. So here that area is shown in red. You can see it is much larger than just a mesial or distal side. It includes the incisal edge, which is the biting or cutting edge of the anterior teeth. Class 5 is a unique position for caries. Class 5 refers to caries on the gingival third of any tooth. Now the gingival third can be on either the facial or lingual surface. This image on the left side shows a red area indicating caries on the gingival third of this maxillary incisor. The image on the right shows caries on the gingival third of this mandibular molar. Class 6 is the last category. Class 6 involves either the incisal edges of anterior teeth or the cusp tips of posterior teeth. Now, typically the only way a patient has class 6 caries is if they grind their teeth, and that's called abrasion. The teeth wear away and those cusp tips or incisal edges are worn down. So in this diagram we see the red circles indicating caries just on the tips of the cusps. The next area that you need to be familiar with are tooth diagrams. There are two common types of tooth diagrams used in dentistry. We have either geometric or anatomic diagrams. Now, whenever you look at a tooth diagram, you always look at it as if the patient is standing right in front of you. So as you look at a tooth diagram, the left side of the paper is actually as if you're looking at the patient's right side. So it's the opposite of what you think it would be. The left side of the paper is actually showing the patient's right side. Here's an example of a geometric tooth chart. Geometric refers to the shapes. We have circles and rectangles. If you notice, these don't really look like teeth, they're just shapes representing the crowns of the teeth. The anatomic tooth chart has teeth that actually look like real teeth. Sometimes your anatomic tooth charts will have numbers. This one is numbered 1 through 32, indicating all 32 teeth in a permanent dentition. As we look at this tooth chart, the left side of the chart refers to the patient's right side, and the right side of the chart refers to the patient's left side. Now, numbering systems are a review for you. We have the 3 common numbering systems that you need to be familiar with: universal, FDI, and Palmer's notation. You will receive a handout in class that shows a diagram of both primary and permanent dentitions, and on that diagram it shows you the different numbers used to indicate each individual tooth using these 3 numbering systems. So make sure you review that and you're familiar with these 3 different numbering systems. On this slide is one of the diagrams that you're receiving in class. This one is specifically for primary teeth. Remember, primary dentition has 20 teeth. There's a little key at the bottom here. So when you look at line 1, Roman numeral 1, that's referring to the universal tooth system. Roman numeral 2 is referring to the FDI system, and Roman numeral 3 is referring to Palmer's notation. Here's the same diagram, but this time it is showing the permanent dentition, and again, using the different Roman numerals here, we're indicating whether it is universal, FDI, or Palmer's notation. Next is color coding. For our purposes in class, I'd like you to remember that when you chart in red, you're indicating work that needs to be completed. When you chart in blue, you're indicating work that has been completed in your office. And for our purposes in class, when you chart with black, you're charting conditions. Now, there are going to be many variations in the dental offices. Sometimes dental offices will chart conditions that require treatment in red, and others will only chart conditions in black only if those conditions do not require treatment. You can even have more variations. Some offices will use additional colors. For example, they might want to indicate work that was completed by a previous dentist. For example, the office I worked in, we would use just a regular gray number 2 lead pencil to chart conditions or restorations that were completed by the patient's previous dentist. This chart is actually a computerized tooth chart. It's a very simplified version. You're kind of limited by what the computer systems can do, what type of charting symbols can be programmed to indicate different restorations and conditions. Now, when you get experienced with both charting tooth conditions and reading tooth charts, you can actually gather a lot of information about a patient without actually looking in that patient's mouth. For example, just a few clues from this specific chart, just reading the symbols here, and you're going to learn these symbols, numbers 1, 32, and 17, with those 2 vertical red lines running through them. That tells us that those 3 teeth need to be extracted. 8 and 9 have a symbol indicating that these need a veneer. Remember, red indicates treatment that needs to be done. A few other things that you can see on tooth number 30, you can see a root canal and a crown on the tooth. It's charted in blue, so we know this is existing. On 27, we see a condition. We see a black circle at the apex of a tooth. This indicates that this tooth has a periapical abscess. On the patient's lower left side, we see a bridge as a recommended treatment. We see an implant on the upper left. So without going through this tooth by tooth, you still get a good idea that you're gathering a lot of information just by looking at the patient's chart. Charting patient restorations and conditions is a very important role for the dental assistant. You can imagine that if something was charted incorrectly, that it could potentially mess up future treatment for that patient. For example, we see number 15 with a charted crown. It's in blue, so it shows that it's done. Now, if that assistant accidentally charted it in blue when it should have been red, we could be missing out on treating this tooth properly. So it's a very big responsibility of dental assistants to chart accurately. The next thing that we will go over are abbreviations. Certain restorations are found on different surfaces of the teeth, and you need to be familiar with these abbreviations. Using the abbreviations, M stands for mesial. Mesial is the side of the tooth that is closest to the patient's midline. And remember, the midline is that imaginary line that runs directly down the middle of the patient. It's a vertical line, and it would run between the central incisors. D stands for distal. Distal is the side of the tooth that is furthest away from the midline. So it's the opposite of mesial. The abbreviation O stands for occlusal. Occlusal is the biting surface of posterior teeth. I stands for incisal, and incisal is the cutting edge of anterior teeth. F refers to facial. The facial surface of teeth is the surface that is closest to the lip. If a person is smiling, what you're seeing are their facial surfaces of the teeth. B stands for buccal. Now, facial and buccal actually refer to the same surface. Facial, we use the facial designation if it's an anterior tooth, and we use buccal if it's a posterior tooth. Buccal refers to the side of the tooth that faces the cheek. And the last abbreviation is L. L stands for lingual, and the lingual surface of the tooth is the side of the tooth that is closest to the tongue. So the lingual surface is opposite the facial or buccal surface of the tooth.